Recognized as the oldest system of healing on the planet, herbal medicine traces its roots back to the earliest civilizations. The variety of plants with therapeutic properties are astonishing. Some 70,000 plant species, from lichens to towering trees, have been used at one time or another for medicinal purposes. Today, herbalism continues to flourish as a people's healing art. Many people, however, do not realize how powerful this art may be. Millions of people every day reach out for a bottle of Tylenol or ibuprofen when it comes to pain relief. A package of 24 tablets for $8.99 will not only give you the pain relief you have been seeking, but it will also provide you with a package of side effects. Let me slow down the fast-paced side effects set at the end of the commercials. Long-term use of Tylenol will cause constipation, liver damage, stomach ulcers and bleeding, and kidney failure. Not only does Tylenol promise you pain relief, but it will guarantee that the next time you have joint pain or any pain of that sort, you will need to take 2 tablets instead of 1, and later on you will need to buy a higher dosage, and so on. This is because Tylenol does not reduce the pain or relieve it. Instead, it works to make it worse, so you come back for more. This is Tylenol, and this is your joint pain. The pain from your joints is caused because of a released chemical called prostaglandin, which causes inflammation and swelling. When Tylenol is ingested, it will secrete a chemical called acetaminophen, or APAP for short. APAP will come in and increase your threshold to pain. For example, before APAP came in, your pain threshold, or the level at which you started to feel the pain, was here. At this threshold, 3 prostaglandin chemicals would reach the threshold and cause pain. With APAP, your threshold is here, so 3 prostaglandin chemicals wouldn't reach the required threshold for pain. So it may seem that your pain was relieved, but in reality, you can't feel the pain signals because you have built tolerance by creating a higher threshold to the chemical pain signal, prostaglandin. It has been a week and you have been taking Tylenol repeatedly. The threshold the APAP chemical set has been masking your pain, not relieving the actual problem. Your body is trying to alert you that there is something wrong, and it does this by releasing pain. With this new threshold, your body creates more prostaglandins in order to alert you by releasing pain once again. Now 6 prostaglandins come in and reach the threshold APAP made. You start feeling pain again and you take more Tylenol tablets, or you start taking the tablets more frequently, or you seek a higher dosage. APAP creates yet a higher threshold, and the cycle starts all over again. This is when you start to increase the medicine intake and the side effects begin to show. Rather than play tag with medications, local chiropractor Dr. Merritt explains how herbal remedies can relieve your pain by stopping it at the source.
Surgery and drugs should be the last resort, and to try natural first, because that is the way your body wants to handle things. It always wants to have a balance and to achieve every system to work at its best. For pain relief, I have found that you first want to find why someone has the pain. We have a headache over and over, and we may think that that headache just is getting in our way, and we don't want to know the why and take an Advil, Aleve, etc., whatever it may be in that kind of fashion. But if it is coming from something, it can be the thyroid, it can be the adrenals, it can be part of how your system doesn't know how to calm down and it has nerve endings that are flared, or it can be even from, say, the injury like I had said before. But we use an herbal and supplemental approach, and nowadays it's called nutraceuticals, not really pharmaceuticals. Those are kind of the same way, but we're using vitamins and minerals in a formula that is targeting to help assist where the main area needs assistance. I do believe that having more vegetables in your diet, preferred organic, because you're not having pesticides and it hasn't been tampered with. Local grown is always better. The food is designed for your climate. Conventional approach is normally anti-inflammatories, painkillers, and muscle relaxants. So those may help for a first 3 days, but to really get to the bottom line is to get to these other things. So we changed the diet first, and less meats, less dairy, and more vegetables and more water, and less coffee. Coffee actually can be more pain-inducing too for some people. But then we talk about herbs and vitamins. The herbs that are the most helpful have been ginger, turmeric. We also have dandelion. Dandelion has been very, very helpful. There was actually a study that omega-3s in the fish oil family can be the natural Advil. And I had recently read also that turmeric is another natural Advil for the system. I have found that acupuncture has been very, very good for pain relief for multiple areas, and it produces natural endorphins. And endorphins are the natural pain relief. Exercise can be a pain relief as long as you're not overdoing it. And stress reduction skills is also important. The more we learn how to relax and breathe and even meditate, or people who pray, these are things that reduce pain. And lastly, one of the areas that I like to talk about, because I discuss a structural, chemical, and emotional approach with health, is to remember that not only is stress reduction important, but to find laughter. If any of you have ever heard, Dr. Norman Cousins was a medical physician who worked with cancer patients and chronic pain. He found that laughter helped increase their white blood cells and reduce their pain. So we do need to look at those areas and balance our life.
Ginger root and turmeric, the spice that gives curry its distinctive flavor and coloring, are one of the safest and best pain relief herbs one can utilize. When you have joint pain, for example, the pain signals sent by your brain, prostaglandins, indicate that the area is inflamed and swelled. Both of these herbs contain anti-inflammatory enzymes that stop swelling and inflammation. Ginger root has been utilized in Chinese medicine for thousands of years as one of the main pain relief herbs, where in another area of the world, turmeric was used and incorporated into many Indian foods for the same purpose. Both herbs are powerful pain relievers with no side effects. These herbs can only be slightly dangerous if one was to take extremely large amounts multiple times a day. According to WebMD, an intake of 3,000 and above would cause problems. A normal intake would be in the hundreds. Since these herbs treat the actual inflammation and not the pain, their effect would last every time they are used. You can buy a package of ginger root and turmeric spice from a local grocery store. In order to prepare these herbs as medications is very easy. For ginger root, the best way to prepare it is to integrate it into a tea. Fill a mug with boiling water, then take a ginger root and grate 2 tablespoons and place them into the boiling water. In order to add to the flavor, a spoonful of honey and a few mint leaves can help with the powerful ginger taste. Allow the tea to sit for at least 10 minutes. This allows the ginger to dissolve into the water. The longer the tea sits, the more ginger will dissolve, resulting in a better herbal remedy. For turmeric, just keep a jar of the powdered spice nearby, and as you cook, incorporate it in your cooking the same way you use salt and pepper. In addition to direct medicinal uses, herbs can serve as a great supplement that can enhance your mental performance. Simple herbs like blueberries and green tea are great enhancers for mental health. Aside from being high in vitamin C and fiber, blueberries are rich in antioxidants that interact with proteins and enzymes in a way that keeps the brain active. Similarly, according to the Harvard Health publications, green tea is also rich with antioxidants that halt oxidative damage to cells. As we age, more cells are in risk of oxidative damage. In other words, damage caused by toxins, sometimes called free radicals, produced with bodily functions which increase as we age. Herbs such as blueberries and green tea halt this damage and secrete these antioxidant chemicals, called anthocyanins, that increase neural communications, therefore increasing memory capacity and decreasing chances of memory loss. In Discovery News, science and health journalist Emily Song reported a study recorded in the Journal of Agricultural and Food Chemistry of memory and learning test results before and after adults drank a couple cups of blueberry juice each day for 12 weeks. After those 12 weeks, the participants were given a memory and learning test. The participants' new scores increased 20% from their original scores. However, some may ask, how about supplemental vitamins? Can't I take that and end with the same result as the blueberry juice? Most of the time, the answer would be no. In a healthy being, such supplemental vitamins and boosters will produce no benefit. In a CNN interview with Dr. Sanjay Gupta, he cited an editorial from the Annals of Internal Medicine, an academic journal published by the American College of Physicians, stating the reality of these vitamins and supplements.
This is a very strongly worded editorial coming out of the Annals of Internal Medicine. It's based on 3 very large studies. One of the studies had over 450,000 participants. So this was a big study, and it's what's known as placebo-controlled. They gave some people the multivitamin, they gave some people basically a sugar pill, and they compared them. They looked at rate of having significant heart disease or a second heart attack, rate of having cognitive memory problems, and they found that these multivitamins did not provide any benefit.
Furthermore, pharmacist Lena explains what is exactly in these supplements, why they are not beneficial, and how herbs can be a better replacement.
If you're healthy and you're getting it from the natural sources, food and diet, then like your dietary supplements, if they're coming from natural sources, it would be way better than just getting them from tablets or supplements. And if you're already healthy, you're not really doing much for your body. Some tablets that you can see in the market that are marketed for raspberry ketones and supplemental coffee beans to help people get the energy or lose the weight or whatever the naming comes after them. If you always take it from the natural source, it would be best because you will be getting it, but you'd have to consume a lot of the fruit or the vegetable really in order to be able to see the benefit. For instance, the raspberries, if you eat the regular raspberries, they are full of antioxidants. All the berries are. Antioxidants can be good for the health. Not giving enough data for the consumers and giving these tablets without knowing really what they do and having other ingredients in there can really affect them. I mean, it's always good to go to the natural source. If you're considering or looking at pills, for instance, like the ones that have ginseng or the ginger root, things like that, those are a different case because it's always, or garlic, for instance, right? It comes in caplets and capsules, and it's always a better source to get the real stuff from when it's fresh, because it tells you, for instance, the garlic tablet, when it's formulated, it's there, but it's not going to have the same effect that it would if you take a piece of a garlic and you eat it.
When you are struck with a winter cold or a seasonal flu, you quickly reach out for a tablet of ibuprofen or a similar synthetic drug. As we mentioned before, these drugs usually only mask the pain or the symptoms, and many times don't treat the source. And in this case, these synthetic medications don't directly attack the virus. Usually, you will have to wait it out. Or instead, you can turn to one of the best and safest antiviral herbs available. A certain herb that enhances bodily performances when it comes to the cold and flu season is elderberry. Elderberry is a very effective antiviral herb that stops the cold and flu symptoms if the herb is taken within 24 to 48 hours after the onset of the symptoms. Elderberry will work to stop the virus from replicating, and it will almost always shorten the duration of the cold or flu by a couple days. This powerful herb is a great preventative and can be taken daily, about a tablespoon a day for adults, or it can be taken after you feel the starting symptoms of an upcoming cold. Elderberry is a very safe herb that won't cease to work and rarely shows side effects. Elderberry can be purchased in your local market. In Charlotte, the Healthy Home Market offers fresh elderberry along with many other herbs. In order to utilize elderberry as a medication in an effective and flavorful way, syrup of this berry is usually made. First, you place a half cup of dried elderberry or a full cup of fresh elderberry into a saucepan. Then add 1 cinnamon stick, 1 tablespoon of grated ginger, 2 cups of water, and cloves can be added for a sweet and aromatic taste. Cover the saucepan and bring the water to a boil. Then turn down the heat and simmer the mix until the liquid is reduced by 1/2. This usually takes 20 to 30 minutes. Then strain the mix into a bowl and add 1 cup of honey. Lastly, store the syrup in a closed jar in the fridge. This syrup will usually last a couple weeks. Many times, synthetic medications such as ibuprofen are taken during a cold or flu, and again these medications only act to mask the pain and don't work to stop the cause of the pain and discomfort. With a few berries and kitchen ingredients, you have just made your own medicine that will treat the source and stop the symptoms instead of masking them. In addition to being a great antiviral herb, elderberry is also anti-inflammatory and can assist in reducing inflammation of the nasal cavity and respiratory tract during the allergy seasons. Dr. Maeve O'Connor is an asthma, allergy, and immunology specialist and founder of the Air of Charlotte Clinic, which specializes in treating asthma and allergy patients.
It helps definitely diminish the production of them. I don't think they've ever done studies where they've actually measured IgE, which is the allergic antibody, with elderberry. I think they've done it more with symptoms. But obviously symptom reduction correlates with having fewer allergic antibodies as well as less inflammation. The simplest thing is saline irrigation of the nose with distilled water. You know about that.
Yeah.
So cleaning out the nose is very effective. And did you know with the stinging nettle that you could actually make it into a nose spray?
No, I didn't know that.
So instead of using a steroid in the nose, which can have side effects such as bleeding and things like that, stinging nettle can be made into a tea. It can also be made into as a nose spray.
I've read that chamomile.
Yes,
It's very good. It helps open up the nasal cavity.
it does. It helps. It helps with the swelling in the sinuses. It opens up the nasal cavities. Again, it's a great tea.
Mm-hmm.
And just so you know, I have all these teas that, any of the teas that I offer or tell patients to make, no added sugar. I just think that the more often that you can use things that are made by Mother Earth, if you will, or God, or whatever you believe in, the better it is for our bodies. I mean, if you look at the way our diets have changed with having processed foods being such a big part of our diet, GMO, all of those things, we're actually creating inflammation in our bodies by putting in things that aren't real. So I think that, again, Mother Earth, God, whatever you want to say, that created plants and herbs and us, the more likely you're going to have a balance in your immune system. We are so unbalanced, not only because of stress, but diet and all the synthetic things we're putting into our body. So I think that when you're turning the immune system up with inflammation, the more natural you are, you can turn that down.
So many common foods and herbs around us contain powerful healing qualities. It's only a matter of opening the door to this exceptional form of medicine. With a few kitchen herbs and foods, you can transform these seemingly everyday plants into your healing cures. The herbs mentioned and presented in this film are safe to take under many circumstances. However, one must consult with a local pharmacist or doctor before taking an herbal medicine in order to ensure their optimum health. Each person's situation varies based on preceding medical conditions and their current health. Before proceeding with an herb or any medication, make sure to be aware of any precautions pertaining to your health.